If you have an upcoming DIEP flap surgery, is your surgeon doing a muscle plication? Did they talk to you about it? Do you know what it is? Let's discuss. During a DIEP flap, we are harvesting the lower abdomen, the skin and fat, for our breast reconstruction. That incision is then closed in a straight line on the lower part of the abdomen. We've talked before in other videos about your anatomy and how that might impact where the incision placement ends up. What a plication refers to is what is done to your muscles. Now, during the DIEP flap, although we try to take no muscle or as little muscle as possible, we still have to kind of root through the muscles in order to get to the blood supply. We repair this during surgery. This is in the individual rectus muscles. Your rectus muscles are your muscles that run right down your abdomen. They're your six-pack muscles. Now, if you've had children, if you've been pregnant, or if you are obese, your rectus muscles tend to separate, and we call this a diastasis. After some pregnancies, it will go back to normal, but after most pregnancies, there's still a separation. How do you know if you have a diastasis? One is we can see it on your CT scan. The other is we can actually feel it on your body. You can feel it on your body yourself. The way to do that, do a sit-up. Put your finger right in the middle of your abdomen and see if you feel a little pooch that happens when you do your sit-up. If you feel this, you probably have diastasis. Now, we can repair that during a DIEP flap, and what we do is we basically just suture the muscles back together in the midline. It's kind of like creating an internal corset. Now, why would we do this? Well, it can lead to a better aesthetic outcome because it's giving you that tightening effect that you also do in a tummy tuck. Now, why wouldn't we do that? Historically, it really wasn't done that frequently in DIEP flap surgeries because of the fear of increasing your risk of blood clots. A DIEP flap in general has a decent risk of blood clots because it's a long surgery and it's associated with decreased mobility after surgery. That's why some patients actually go home on blood thinners after this surgery. The thought was, by doing this plication, cinching your muscles together, you increase your intra-abdominal pressure, which puts more pressure on your pelvis and the veins in your pelvis, theoretically leading to an increase in blood clots. This has subsequently been disproven and most people really don't believe this anymore. So that reason is kind of removed. Some might argue it takes time. It takes about 10 minutes, if that. So that's not really it. I do it in most of my procedures, except if I am doing some type of hernia repair during surgery where I feel like it's not safe to do the plication, or if a patient's BMI is high, thinking 35 plus, because it really doesn't make a difference. There's enough subcutaneous fat that you really don't see the impact, so it's not worth the additional time and subsequent pain that a patient might feel. If they do have a plication, let me know below.